In 2012, my father passed indirectly from prostate cancer. 2013, my brother had prostate cancer. I found out really I had prostate cancer was in April of 2014. How you doing? My name is Lawrence Davis. I'm with the Hampton Roads Prostate Forum. Okay. If you have a cancer, Proton is the best way to get it taken care of. I in turn decided to go with Proton. The VA told me they would not do that. Wouldn't even pay the 20% that I need to pay for doing it under Medicare. It says proton beam therapy has not been deemed as an appropriate option. So his request has not been approved. After reading this letter here and looking at what Medicare has paid, for me being a retiree, I could not afford the extra cost of paying that extra 20%. And so I raised hell back and forth about, no, I can't have this, I won't have it. This thing has got to get out of me some kind of way or another.
Cancer does not discriminate. Cancer strikes the old, the young, black, white, and what we're trying to do here at Hampton University Proton Therapy Institute is to have a place that gives those people hope. We treat all types of cancers, including GI, lung, head and neck, prostate.
For prostate cancer, patients treated with proton beam radiation, the GI complication rate drops to 0.5%. And that is just a remarkable improvement over what we can achieve with our regular X-ray-based treatments. It's in fact a tenfold improvement, and we're very proud to be able to offer that for our patients.
There was no side effects, none. I was able to function in my job. It was the most unbelievable experience of my life.
Brain and spine, breast, and pediatric.
Derek starts coming through, and he sees the mohawk. The nurse points it out the first day and then taps on the glass and is like, hey, look. And his face, he just lit up like Christmas, which made me light up like Christmas, and we're just so happy. It was so exciting, and just to share a connection with someone and know that I can make someone's day a little better.
How do you feel?
Good.
How good?
Very good.
And clearly, proton therapy eases human misery and saves lives.
That bell signifies the completion of a patient's fractionated course of radiation therapy. So they have been through usually anywhere from 4 to 9 weeks of daily radiation therapy, and for them, ringing that bell means they are finished their completed therapy, moving on to the next phase, and hopefully cured of their tumors.
Oh, that's the best part of the day is when I hear the bell. We celebrate just as much as everyone out in the lobby.
We need a universal approach to funding, whether it be from private donations, whether it's from state funding, whether it's from the federal government, in order for us to continue our mission of saving lives and easing human misery.
Joanne worked very hard for the Proton Treatment Center for the funding for it because she thought it was very important to the community. She had breast cancer. She was diagnosed in 2005 or 6 and up in D.C. And when she got out, came out of the cancer treatment, out of the surgery and all, they said she was totally cancer-free. And then within a year it came back, and it came back with a vengeance. I think she would probably say that there are some things that we could do without and some things that we need to fund. But certainly she would think that the Proton Treatment Center at Hampton University is one of those areas that need to be funded. It's so important that we have options other than just chemotherapy and surgery.
I was given only 3 options of treatment.
Cryogenics.
Prostatectomy.
I could have the seeds put in.
Or standard radiation.
Or I can do external radiation.
I said, "You've left one out." He said, "What's that?" I said, "Proton therapy." He said, "Well, there's not enough outcomes." Well, I knew there were outcomes. I had done enough research to know that they were outcomes.
The University of Florida published the results of a 5-year prospective study that demonstrated a 99% freedom from PSA progression at 5 years for both low-risk and intermediate-risk prostate cancers.
These doctors, even though I questioned the ethics of it, were going to direct me into their radiation program.
In the United States, we tend to try to keep our patients within the vertical tiers of hospital integration, which is a fancy word for saying the folks in one hospital system like to keep their patients all within that hospital system. I would hope that my physician would sit down with me and take off his brand and take off his hospital association and speak to me with the honesty of a physician, because that's really what I'm coming to him for.
There are many patients who cannot necessarily afford to get this treatment, so we have established a fund here through our gala to help to pay for those costs, out-of-pocket costs to those patients. In order for us to complete this mission, it helps us with giving funding and funding assistance to veterans like Mr. Lawrence Davis.
I had been praying for there will be some kind of way that I can do this. I've learned about Proton, and I learned about what Dr. Harvey was doing, because I like that guy. The finance department of the Proton Center, what they did, they went out and searched and found funds for me, and I found that the funds come from galas and different things that they give to help indigent people. I'm just so excited that I'm going forward with this. Say now, bring on the protons. Yes, indeed.